Your son is on the autistic spectrum.
Wow, Doctor. What does that mean?
Well, let me show you.
So you realize someone you know has autism.
You might be wondering what symptoms they have shown that has led to their diagnosis.
Here are some of the most common symptoms used to identify autism spectrum disorder.
People with autism spectrum disorder often do not respond normally to social interactions.
People with autism often have trouble with non-verbal communication, including showing emotions on their face and keeping eye contact.
People with autism spectrum disorder often have difficulties developing friendships or have no interest in them.
People with autism spectrum disorder commonly make use of repetitive actions and speech patterns which can manifest through lining up toys, idiosyncratic phrases, and repetition of other people's speeches.
People with autism spectrum disorder are often oversensitive to their environment. Conversely, they can also be undersensitive.
With the release of the updated American Psychiatric Association's DSM classification system for mental disorders, DSM-5, autism was expanded into the more inclusive autism spectrum disorder.
This has led to previously separate conditions, such as Asperger's syndrome, being classed under the autism spectrum.
Part of the controversy about autism classifications is due to the lack of conclusive evidence towards the cause of autism and its related conditions. Due to this, definitions and classifications have changed numerous times, with the DSM-5 classification simply the most recent.
There is also controversy about the way autism spectrum disorder is treated as a mental illness. Some believe in the concept of neurodiversity, which is basically that alternative mental conditions such as autism spectrum disorder and bipolar disorder shouldn't be treated as mental illnesses at all.
The movement seeks to combat the stigma many people with abnormal neurological conditions face, and is supported by the fact that most of the disorders encompassed within the movement do not have effective medical treatments or cures.
In order to support an autistic child's communication, try speaking less, simplifying your language, expressing one idea at a time, using simple natural gestures to support your spoken language, using positive statements instead of negative ones, such as, "We are quiet inside," instead of "Don't shout," and using statements instead of questions.
Children who are on the autism spectrum tend to be visual learners. You can support this by using visual aids when teaching. Visual aids help children understand what is expected of them and allow you to communicate effectively.
Children on the autism spectrum often find it difficult to pay attention. They may not understand what you have said or only understand a small part of it. You can help this by getting into their line of view, speaking directly to them, using one statement at a time coupled with a visual aid, and providing positive feedback when necessary.
So now that you've been informed about the autism spectrum, I hope you can take good care of your son.
Great!